And then our next question, this was really asking, so we're all doing work in the men's mental health space, but it's certainly not the only space that we're working in. And I'm wondering, in what ways can work in men's mental health help to advance equity with women and gender minorities, including transgender and non-binary people? And feel free to share any examples or insights from your own work, or of course, speak more generally as well. And anyone want to go first?
Yeah, I can go first here.
Great, thank you.
So I guess picking up on Francine and Jennifer's point about representation. So we as mental health researchers and clinicians working in the field need to ensure that our workforce matches the diversity in society. So having representation in terms of sexual orientation, gender identity, and women, as we have here, that's a basic step towards equity. And I think as a group, we're doing well there. In terms of the research itself, picking up on the point Francine made, I think we need to think about whose voices we are including in our research, and we need to prioritize research that centers the voice of those subgroups who are experiencing the inequities. And I think we need to focus on the individual lived experience, but also the experience of stigma and discrimination at all the levels, from individuals right through to the health system and at policy levels. And I think there is an area that we can focus on. There's been mention of intersectionality as a framework, but there's also a gender relations framework, which comes from the work of Raewyn Connell, who acknowledges power relations. And it's often the power relations that are creating or maintaining inequities. And I think often mainstream public health research is not so good at acknowledging power relations, but it acknowledges that these power relations exist between men and women, but also among men and among women. And they create this hierarchy of gender relations that has implications for men and women's mental health and illness outcomes. So those are a few of the ways I think we can advance equity in the field.
Awesome, thanks so much, and really helpful reminder that when we're talking about equity, we also need to be talking about power, so thanks. And then maybe over to Francine or Jennifer, if either of you want to go.
Sure, I'll jump in. Sarah, that was a lovely response. So I think sort of building on that, I'll speak to an example that from the research that we've done. So one of the studies we did was looking at service provider, mothers, and fathers' perspectives. And we had these three sub cohorts, and we wanted to understand, their experiences of fathers' access to programs. And ultimately what we found was that there are family gains when fathers were included. So what was interesting about this was that the fathers were, ultimately what they were arguing for was, strengths-based inclusivity in the childcare and parenting services that were offered to mothers. So they just sort of wanted this like equitable access to programming. And the mothers who were looking, at the issue of exclusions of fathers, they wanted to include the fathers, or they wanted to ensure inclusiveness of fathers because they were ultimately bearing the brunt of, sole parenting. And it was more because of these power dynamics at play, or the ways in which, the systems and structures were in place to support mothers, and in some ways to protect them. But ultimately, it in some cases, it created a greater burden for them. And then when we looked at the service providers' perspectives, they really identified that this, the current gendered approaches to providing supports to parents and the provision of those supports was actually, impeding support for mothers, for fathers, and, you know, ultimately for children. So I feel like that was a really good example of looking at, you know, creating greater equity or equitable access for fathers really had gains for partners and families. In terms of it, you know, thinking about the second part of the question, thinking about transgender and non-binary people, I think there's ample opportunities to advance research in the area of parenting, and considering the additional barriers that these individuals experience in relation to accessing resources. I think, and you know, maybe someone can enlighten me on this call if they're doing work in this area, but I think that transgender and non-binary individuals would be they would be likely unable to identify themselves in the current services that exist. So I think, you know, that they're very much being excluded. You know, I'm thinking even you know, within the downtown East Side context, we know that there are much more, you know, single parent female-headed households. And that's much more prominent than single parent male-headed households, you know. So I'm certainly not saying that need is not there. That's undeniable that we need to support that community. But I think that we also need to consider those who are being excluded from services. So again, in a lot of cases, this includes, you know, single fathers, and it certainly includes transgender and non-binary individuals who I think are completely, you know, further marginalized through these processes.
Really important examples. Thank you. And we'll turn it over to Jennifer, please.
I can also speak about just some examples from our research. So in working with men and violence between couples, a big part of the modules and a part of the intervention is about, you know, balancing a bit more in terms of power and how it's expressed. Often violence is an expression of power in reaction to, in our context, it was often in reaction to some perceived like challenging of men. And that could be like requesting school fees or something for children, you know, to money for children in some way, some clothes, often basic needs in the settings where we're working. But that was met, those requests were sort of interpreted as being challenged and like insulting. So, you know, women saying in like a backhanded sort of way that men aren't providing for the family. And there's a response with violence. So a big part of what we do and what we've seen are these downstream effects on the family system, women and children. We have a qualitative paper from research in Kenya. And this was around an intervention for men to reduce alcohol use. And that was led by Eve Puffer at Duke and Ali Justo, who was her student and now is a postdoc with me at Columbia. So they did this intervention and then they interviewed both women and children. And as you would expect, as men's substance use reduced, there were a lot of benefits, perceived benefits to the family system. There was money that was being used for substances that was going back into the family. They reported, you know, that their father was spending more time with them, both with children and with partners. It was much more harmonious, less conflict in the family. So definitely, you know, strong effects on women and children. We also did some work in Colombia with displaced people around looking at intersections of violence against both women and children. And there too, you know, people talked a lot about the stressors that men would face and trying to provide for families in this context of displacement, you know, already so difficult and potentially recruited by rebels and things like that, very dangerous contexts. So when there's some sort of intervention, especially around mental health, but also could be around just economic intervention and getting basic resources, and then better mental health is sort of mediated, then we see too, advances with women and children and better mental health overall. So the second part, transgender and non-binary people, unfortunately, my work does not focus on that. And a strong reason is inequity. Many contexts where I work, it's actually, dangerous to ask people about sexual orientation. And so, just for ethics and for other reasons, we are not able to address this issue, but it's so important. And I think, as more equity we have, more flexibility around gender roles, and less violence, less discrimination.
Great, thank you. Some really good insights about what's working well or could be, and also where we can go from here.